Okay. All right. Hello, everyone. Good afternoon to you all. Yes. So, hello, everyone. So, this is basically related to ObGyn Residency as such. So, even in residency, most ObGyn Residency starts with one emotion, right? It's often pure panic. There are so many things to deal with as such in residency. So many instruments are there, so many emergencies are there, and suddenly you are expected to know everything, right? Starting from ovulation to obstetrics, maybe till even assisting surgery, and even individually performing the surgeries at that segment. But what if I told you your ObGyn residency need not be so chaotic? It can actually be very well structured, enjoyable, and even life changing as well if you approach it in the right way. This right approach is very, very important. So, I'm Dr. Gayathri, so a gynecologist, a teacher, and a mentor. And so basically, I did my residency from AIMS Delhi. I was the topper of my batch. I followed by that I did an MRCOG degree, a secondary DNB FMAS fellowship in laparoscopy, and even the winner of the prestigious Triceptorendian Scholarship Award. Looking at all this, it might seem that it was a smooth journey, but trust me, it was not at all a smooth journey. There were so many days I felt completely lost. There were days where I genuinely felt like quitting. There were such days where it was so hectic without sleep, without food, and of course, the mounting amount of pressure that's on you to finish the ward works, to finish the practical things, at the same time to excel in studies as well. And of course, there are few days when everything finally made sense as well. And it felt like it was all worth it. I still remember my first day as a resident in the labor room ward, totally clueless, like don't know what to do, completely overwhelmed, and wondering where to begin as such, from where to study, what to prioritize. And it's a whole new world. Now you are in a scenario, most of us, we are away from our home, we are adjusting to everything. At the same time, you are expected to learn all these things very quickly and excel in them as well in a very short span of time. And honestly, surviving in those first few months in the residency itself is a huge task as such. Now that I have been on both the sides as a resident and as well as a faculty and a consultant, I know exactly how confusing, overwhelming, and sometimes or even lonely this journey can feel. So my residency at AIMS as such, it was not just a degree. There were a lot of duty hours. It was a roller coaster ride. Even there were days we had to reach the ward. Not even days. There were most of the days when we had to reach the ward by nearly 6:30 a.m. without breakfast. We kept on going sometimes for 36 hours with 2 a.m. emergencies. Thesis guidelines were there. So many seminars were there. And I'm pretty sure majority of you are going through the same thing, and even the exam dates and timelines which is haunting in the background. Don't you have those days after a 24-hour labor room shift? The next day, you are expected to maybe present a case or maybe discuss with the seniors. And at that point of time, you're just thinking, oh God, what to do? I have not read the theory. Maybe you had just taken the case and you're just pushed in front of the consultant where you have to present the theory in front of all your peers. And there are those seminar days where in a hustle, we manage it between all these things. We don't get that good connection between this theory as well as practical things that is going on. But you know what? That all those phases where all these struggles are there, that is the time where you grow most. You develop the resilience. You transform from a medical graduate into a confident, independent gynecologist as such. Honestly, in my first year, there were barely time to sit and study as such. But lucky for me, I was many a time surrounded with some incredible seniors and mentors and legends who actually taught me so much in between all these hectic schedule. And I have seen many residents actually struggle working day and night, unable to connect all these aspects. And many times they lose the interest as such, like what to study, how to study. And this is a long journey. It is very important that you love it. You can just struggle and go through it as well, or you can start enjoying it. It's a very long journey, and it's important that you start connecting the dots. And that's the point of time when you start seeing the beauty in ObGyn. Provided you don't understand in your mind, you don't see these beautiful aspects of management, or you don't realize what is actually going on. And it is very important that you are guided in the right path as such. And that's why we build this residency program, the ObGyn Residency program, to make your 3 years structured, understandable, and actually enjoyable at the same time. Because during time of residency, it is not just about surviving somehow these 3 years. We have that mentality now, we have to just finish off these 3 years, then finally I'll be a consultant. That's the point of time when I'm going to enjoy the life. But even this residency time is the most crucial foundation years. There will be no one after that to hold your hands, to tell you these things. We have to develop, along with the practical skills, the core theory concepts, and to connect all these things. It is very important as well. So it's not just about thriving in residency. It's about coming out exam ready, even patient ready, and future ready as well. So how to approach this ops and guide residency assets in the right way so that you are able to connect all these things. So let's start with the basics. Foundation is important. Before rushing to OT, just reading bits and pieces over here and there, or managing some clinical ward patients just by taking some bits and pieces, it's important that you start right from the basics itself. Know about the anatomy, physiology, the steps which are important. And in this residency program, one of the key aspects is even the foundation subjects are actually taught by the subject specialist itself. You will see there is in-depth anatomy lectures, which is conducted by the National Anatomy Faculty as such. You have physiology lectures right from the experts, statistics right from the experts. So all those things right from the basics, we are building your concept so that you don't feel left out, or you don't feel that bridge between the core concepts as well as the foundation which is there. Not only that, in the time of residency, many a time we feel that we don't even have time to pick up the book and read anything. Believe me, the patients are your best friends as such. You observe them, you learn from them a lot. Maybe you saw a case of cord prolapse that day. Rather than just leaving it there, in the same day, if you just read about it, the risk factors, the management, how to deal with it, how to avoid it, believe me, you are going to remember it 10 times better if you connect it at the same point of time. We all know this, but the thing is that in between all the rush hours, we often procrastinate it maybe for a later time, or we feel like we are going to read it some other time. Again, this residency program, you're going to get it in such a concise way so that you are able to even revise this on the go, or maybe in the few free hours that you get as such. So you observe the patients, or maybe you observe the cases as such, you assist in the surgeries, finally you do them, at the same time teach the people around you. So that's when the cycle actually is completed, and that's your growth ladder. Every delivery, every LSCS, every PPH that you watch, assist, perform, and then teach, that's when the learning gets completed as such. Again, the ward rounds that you do, everyone does ward rounds, right? That is a core aspect of residency asset. It should not be just like a grit work. During this time, it's a time for active learning. Don't just keep on writing whatever is there in the note. Ask yourself, what's the diagnosis? What is the management? Why is it being done? And what does the guideline say? So many times we will see that there are some things that is actually practiced which might be slightly different from what the guidelines actually says. So you understand that there is a difference, and why is it so? Is there some variation in that? That's the time you start analyzing. So you observe what is happening in the wards, at the same time connect it with the guidelines, and after that it is always better if you make notes, scripts notes from what all you gathered, this practical aspect from guidelines and everything, so that you have something substantial with you which you can read in the long term, which you can revise as well. That will finally help you in the long run. There are maybe 20, 25 resources out there, and it becomes often a Herculean task for the residents. Finally, maybe you read it once, but finally during the time of exam, especially you will see that Williams and all, there's so much beautiful, vast load of information that is given. But I often see residents struggling with recollecting all this information which is there. There are so many things, so many places, assets. You have Ian Donald, you have this area, so many things are there. But if you compile it into your own notes, which is readable, which is compiled, it is going to help you a lot, not only to understand these things, but also to write it in a very organized way as such, even in the exam, and to impress your examiners during the time of practicals. During my time of residency, what I used to do was inside my lab coat, always you have that apron, a white apron. Inside that, we have that inner pocket as well, which always had an iPad. So on the go, there are some times which is free spare time as such. So sometimes which is not spent much productively. At that point of time, if suppose there was some interesting case that happened in the ward, I used to just read on that a bit, at least maybe not completely. You can't be a perfectionist during these times in residency. Many times it can be even bits and pieces. I used to just read about it, maybe take a screenshot, scribble something about it into Notability or any note taking app as such. And afterwards, once I get time, I'll properly read about it and build on those concepts. But even that small amount of time, the free time, which is used productively, that made a lot of difference. Even those all those little drops of water that added up to much assets, which helped me finally even to top in the AIMS final exam and even to be the Torrentian Scholar Award as well in that year. So all those little things do matter. So utilize your spare time like that effectively so that when you're home, you have some time for family as well. You are able to balance all these things out. Just use your time which you are anyway spending in the hospital. If you have any spare time assets, of course, have time for food and everything. After that, if you have any spare time, try to read about it. Especially, I would say in the labor room postings. When you have, of course, we have those spare time in between. Try to make some quiz notes, or maybe you read something, try to teach it to whoever resident or maybe junior who's there with you. Or if you are in the starting batch in the first year and all, you can even discuss it with your seniors. You will get so many pearls from the seniors. And I know many places, there are places where you're not very well guided by the residents or maybe seniors. There are places where you're blessed with so many. But whatever it is, now you are in an era where you have all kind of information right there with you, just in a finger touch as such. So in this residency program, it offers you not only just lecture series, it is going to be a guided roadmap that is designed for the residents, made by the consultants. So the old residents to the new residents, this is going to be a complete program as such. There will be support by the experienced ObGyn consultants. We have covered in this nearly 200 hours of lectures. That is for 199 topics are there, which is covered in 200 hours. And you will get these real life clinical case discussions would be there. There would be practical tips from labor room, OTs. There are surgical videos as such added with demonstrations that are going to teach you like what are the surgical steps to take care of. And a lot of guidelines have been summarized. I know I told you there are a lot of reference, and as a resident, it becomes often so overwhelming, like where to refer upon. There are so many vast plethora of references as such. You don't know whether to go ahead with this book, that book. You have ACOG, RCOG, FOXY, so many guidelines as such. So in each of these main lectures, we have made it a point that the important core aspects of these guidelines are incorporated into the lectures as well, so that you don't have to go into it by yourself. If at all you feel like going ahead, you have more time. Many times we feel like going a bit into it. Of course, you can feel free to, but majority of the key things that you require for your exam is there ready-made provided to you as such. And soon we are going to launch these dedicated OSCE, Viva OC, and even demonstration modules as well. Yes, that's upcoming in the soon future. So basically, it has everything that you wish someone had told you during the time of residency, all in one place. And that's the key aspect of this residency program. And it's going to be, of course, residency friendly. There will be short sessions that you can literally watch on a duty break. There will be soft copy notes. There will be workbook style PDF for active recall and practical lessons that will help you to shine as well in labor room, in the ward, in the OT, and in every aspect of your life. So, and main aspect is, I feel that rather than rote learning, always the learning becomes much easier when you start seeing your case differently, when you start loving ObGyn. I think the most important aspect is to fall in love with ObGyn. Especially, I'm just giving an example, preeclampsia case won't be just a theory session on DP, proteinuria. You will understand the pathophysiology. You will understand how the counseling works. What are the management problems, management algorithms that you should know. You will feel prepared for the exam, confident in the discussion. You will feel calm even in the emergencies as well. Basically, our aim is that you should start falling in love in ObGyn all over again. Many times during the time of residency, due to all these harsh environment, maybe a bit of toxicity, maybe a bit of all those sleepless nights and hungry tummies, we often start not feeling that much passion towards obs and gyne. Yes, I think majority of the residents have felt at one point of time. I don't know about everyone. At least I had felt at some point of time. Maybe it was too much for me. Especially in the first year, I felt like, okay, is this my calling? Should I just quit? That kind of feeling was there. But gradually, once you start loving it, there's nothing like nothing more than that. And you have to reach that phase where you start loving obs and gyne when you actively learn all those things. And at that point of time, the whole thing changes from that gray environment which is around you. It starts feeling more colorful. You start enjoying the process and you start automatically scoring more. So yes, so this residency program I hope will help you to start enjoying and falling in love with obs and gyne all over again. And of course you will be guided by our expert team of mentors who has walked the same path. There will be a supportive community because no resident should be felt alone in the journey. So this is the whole team of experts as such. From we have faculties from Obs and Gyne itself who will be helping you with each of the individual modules as such. Apart from that, we have even other subject specialists from anatomy, from physiology, from pharmacology, from statistics. Who better can teach them right from the experts? You are learning each of these things. And these are the core modules that is covered as such, right from the basics till all the advanced concept has been covered in these lectures. So, my dear students and my dear residents, if you are ready to make your residency more structured, more confident, and honestly more fun, this program is for you. So, we have launched this program and you can join it through the link which is provided here. So residency is very, very important. Let's build your foundation. Let's build it strong. Let's build it together. So thank you so much. I can't wait to see you inside in the program and interact with you all as well. Any doubts or queries, feel free to ask.